Hello and welcome to Week 2, Part 2 of What the Health. Today's post will cover sections 1002, 1003, and 1004, which is the rest of Title I, subsection A. Section 1002 is an add-on to the Public Health Service Act. It gives the Department of Health and Human Services the ability to make grants to states. This money can be used to start or expand an Office of Health Insurance Consumer Assistance, or to start or expand a health insurance ombudsman program. Ombudsman, by the way, is a term that just means an official person. Before we tackle the eligibility criteria for the states to receive this money, let's talk about what these two things mean. An Office of Health Insurance Consumer Assistance is just what it sounds like, an actual office with windows and walls and doors and desks. An ombudsman program refers to the people that work in that office. So these grants give money to states not only to have these offices, but to staff them as well. Now, before the PPACA, there really wasn't a state-run place for people to get help finding affordable health insurance, or if their claim was denied by their insurance company. That sort of aid all came from private organizations. Starting or expanding a state-run health insurance consumer assistance program means that we now have another source of information for health insurance-related issues. So you may be asking yourself, how does my state become eligible for these funds? First, each state must have a designated office or official person who works directly with health insurance regulators and health insurance companies in that state. This office or person will be responsible for carrying out the terms of the grant. Once a grant has been awarded, the office is responsible for helping people find affordable health insurance, file any appeals with their insurance company, and learn about their rights and responsibilities when it comes to health insurance. The office also has to report back to the Secretary on any problems and questions the public has. The Secretary will use this data to check up on how the states are doing and also keep insurance companies accountable. Now, the question that gets asked most often with new laws is, how much is this going to cost? Well, according to this section, about $30 million a year. This money is supposed to come out of funds from the Treasury that have not already been earmarked. This means that $30 million cannot be taken from any other program. Section 1003 is another amendment to the Public Health Service Act. Now, in Part 1's video, we talked about some new laws that are designed to ensure that we get the most value for our monthly health care insurance premiums. Section 2794 expands on that. It prevents insurance companies from raising premium prices without public warning and without a really good reason. Before putting a premium increase into place, the insurance company must submit reasons for the increase to the Secretary and post notice of the coming increase on their website. While this won't stop your insurance company from raising your premium rates ever, it will stop them from doing it without justification. The next subsection makes sure that this happens the way it's supposed to. The Commissioner of Insurance for each state is responsible for tracking any changes in premiums. In fact, the Commissioner can even recommend that a plan or company be excluded from the exchange if they're showing a pattern of excessive or unjustified premium increases. Let's talk about the exchange for a minute. Essentially, it's a marketplace for insurance shopping. Any plan that's included in the exchange is eligible for federal subsidies. This means insurance companies are going to want their plans included because it means more money for them. All exchanges have to be in place by January 1st of 2014. At that time, the Secretary will also begin monitoring any increases in premiums. Now, all this monitoring doesn't come for free. Over a 5-year period, which started back in 2010, a whopping $250 million is up for grabs. Now, the Secretary has to develop a formula for eligibility based on the population of a state and how many insurance companies are in it. But any state that qualifies is guaranteed at least $1 million, but no more than $5 million. Any funds that are not used by the end of 2014 will be given as grants to help with insurance reforms and member protection. This means that any extra money should be going back to the Offices of Health Insurance Consumer Assistance. Section 1004 consists of just 2 very wordy sentences. Boiled down, they say that sections 1002 and 1003 became effective back when the law passed on August 25th, 2010. I know we said March 23rd, 2010 in an earlier video. Here's the thing. The PPACA passed into law on March 23, 2010. On August 25, 2010, the Health Insurance and Education Reconciliation Act passed. This modifies parts of the PPACA and gives us the version that we all know and love today. Oddly enough, this means that I now share my birthday with the PPACA. Take a moment here and pat yourselves on the back. You have made it through Title I, Subtitle A of the Patient Protection and Affordable Care Act. Enjoy your accomplishment, brag about it to your friends, but come back here on Monday when we dive into subsection B. Healthcare reform waits for no one.